here in DDW, you presented a clinical trial using mesalazine and probiotic. Or you have to tell us about your new data.
This is the first randomized double-blind placebo-controlled study in order to prevent the recurrence of symptomatic and complicated diverticular disease. Because we have no current treatment in order to prevent the recurrence of the disease. In this trial, we found that patients treated with mesalazine, but in particular when used a combination approach with mesalazine and probiotic, had a longer remission than patients under placebo. This is a very interesting result because we have for the first time a specific answer to current question clinical practice. What should we do in that patient after the first episode of symptomatic and complicated diverticular disease? How we can prevent the occurrence of complication? This trial is probably the first answer. Of course, the best dose of the drugs, the best use if it should be taken daily or as a cyclic treatment. It should be investigated in further trial, but this trial is the first step to understand clearly what should we do in clinical practice.
Very nice. And how about the diverticular disease, the asymptomatic patient? Should we do something or wait?
Oh, this is a very important program in clinical practice. Yes, because most of patients are symptomatic. A lot of patients don't know that they have diverticulosis. What should we do in that patient? Nothing. No treatment. If the patient is asymptomatic, for example, if we recognize the presence of diverticulosis during a colonoscopy, for example, for colon cancer screening, if the patient have no symptoms, the patient have a regular bowel habit, no specific indication of treatment. The treatment can change if the patient, if the asymptomatic patient show alteration at the colonoscopy, or for example, alteration for a bowel enema. This is a different approach because in this case the patient should be analyzed and should be followed because the patient may be probably develop other symptoms in the future. But the patient which we have a accidental recognized of diverticulosis, simple diverticulosis without any other symptom, the patient should not take any treatment.
As we have an overlapping of symptoms between among different diseases, what do you have to tell us about, for example, calprotectin and the perspective the use of new technology?
Yes, this is an important problem in clinical practice because most of patients have overlap between diverticular disease and irritable bowel symptoms. Most of symptoms are shared, for example, alteration of bowel habits, in particular constipation, or the symptom, for example, abdominal pain. The characteristic of abdominal pain may be very useful in differentiating between diverticular disease and irritable bowel syndrome. But probably calprotectin may be more easy to use, very easier to use in clinical practice because calprotectin, we know that calprotectin shows a slight increase in that patient. So if we detect calprotectin slight increase, probably this patient should be investigated more in depth, despite the presence or not of symptoms. This is a very important point because patients with diverticulosis showing also increase of fecal calprotectin probably have a low-grade inflammation. And this patient probably may develop in the future symptoms or complications. And probably this is the first target of treatment in that patient. Calprotectin may be very useful for to screen which patients suffer from symptomatic and complicated diverticular disease and which patients suffer from irritable bowel syndrome.
Okay, very nice. In behalf of the name of Brazilian Federation of Gastroenterology, I thank you very much.
And thank you for your friendship.